As mentioned by Nora, my presentation is going to be on alternative treatment options for endometriosis patients when traditional pain management is not working. So just a little bit about me. I'm a third-year medical student at Rowan University School of Osteopathic Medicine. I'm from New Jersey here in the USA. And my interest in OBGYN began when I worked with a minimally invasive gynecology surgery specialist who focused on chronic pelvic pain. I worked with her and I met countless patients who were experiencing chronic pelvic pain from endometriosis, and I noticed that they all had one thing in common. At one point in their life, they believed that their pain was normal. And it was to the provider that I was working with to educate them that the pain that they were experiencing was pathological and it had a pathological source. And this really was impactful for me because I saw kind of like a niche within medicine that I wanted to pursue. So I'm hoping to pursue education in gynecology and women's health, specifically in educating women about chronic pelvic pain and their sexual health. So what is endometriosis? We've heard a few talks about endometriosis so far today. You might remember that 10% of women of reproductive age are affected by endometriosis. It's defined as ectopic endometrial tissue growing outside of the uterus. And the most central clinical feature of endometriosis is pain. So it's an inflammatory process. So similar to other inflammatory diseases, you're going to have a lot of pain complaints from these patients. This includes dysmenorrhea, non-cyclic pelvic pain, dyspareunia, and dyschezia. And so these patients are experiencing pain in some of the most pivotal experiences of human life. They're not able to enjoy sex. They're not able to go to the bathroom because they're constantly in pain. So most of the literature describes obviously the inflammation as the mechanism of pain, but there's also literature that supports that there is a central nervous system activation aspect of the pain that's experienced, as well as myofascial dysfunction that contributes to the pain that's experienced by these patients. And of course, most patients, when they experience pain, whether it's endometriosis or not, are going to the local drugstore, grabbing some ibuprofen or NSAIDs, and they're self-treating their pain. Additionally, if they go to the doctor, their doctor is also going to tell them to try some NSAIDs for their pain. And this is all attacking the inflammation aspect of their pain. But I'm going to talk a little bit more about some of the other ways that we can tackle pain management. So the current treatment protocol for endometriosis works by targeting these mechanisms of the pathology. So we're talking about inhibiting ovulation, downregulating ovarian steroidogenesis, inhibiting angiogenesis, inhibiting local growth. So this is through your OCPs, your GnRH agonists. These are hormonal ways that we are slowing down the pathology and the ectopic growths of the endometriosis, but it's not necessarily talking about the exact pain. So obviously, if you decrease the pathology, you would think that you would decrease the pain, but you'll see that that's not always the case. And then the other aspect of these medications and these treatment plans is that there's a lot of side effects. When you're giving patients hormonal therapy, even if it's to help with their pathologies, they're still going to be dealing with breakthrough bleeding, breast tenderness, nausea, headaches, mood changes, and a whole other slew of side effects. And then not to mention, with NSAIDs, a lot of these patients who are taking NSAIDs regularly and for many years of their life, since they're starting out with this pathology at such a young age, then experience gastric complications because of these chronic NSAID use. So is our current treatment regimen for endometriosis enough to provide adequate quality of life for these patients with chronic pain? I proposed no, it's not enough. And so why does pain management need optimization for these patients? These patients are experiencing persistent pain after treatment of their underlying pathology. They're having pain reoccurrence. There's a significant amount of patients who don't even have adequate control to begin with, let alone reoccurrence. And literature shows that about 72% of patients desire more relief. And another key component of my literature review that I found was that the degree of pathology does not always correlate with the amount of pain experienced by patients. And this is something that's not uncommon in other illnesses that cause significant amount of pain. And between medication treatment versus surgical treatment, there isn't a statistical significance indicating a superior treatment method. It's really about where the patient is in the pathology, what their contraindications are, what their preferences are, and where they're at in their treatment regimen. All right. So in my literature review, I essentially looked at the endocannabinoid system and acupuncture as alternative methods of managing patients' pain. I specifically focused on these two because I know that there's a lot of medications out there in terms of regulating endometriosis patients' pain. And so I wanted to explore options that could be added in conjunction with the hormonal medications that a lot of these patients are on. Because if you have a patient on OCPs and the OCPs aren't working and you decide to go for another hormonal way of managing their pain, you then have to stop the OCPs and change the hormone regimen. And then if the patient's undergoing surgery, that's a whole nother slew of, preparing for surgery and recovering from surgery, and they can still continue with their hormonal management. But there's still another component of the pain that I think is not being addressed. And so the first system that I want to talk about is the endocannabinoid system. So there's a lot of literature that talks about the endocannabinoid system and the way that cannabis can be used to manage pain. A lot of this is seen in cancer patients and in inflammatory bowel disease patients. But there is a little bit of literature right now that's talking about the endocannabinoid system within endometriosis patients. And so what the literature has identified is that there is a TRPV1, a non-selective cation channel that is shown to be expressed on ectopic endometrial lesion cells. And then there's the CB1, CB2 receptors, which are the more common receptors that are associated with the endocannabinoid system. CB1 is kind of what causes the psychoactive effects of cannabinoids, and CB2 is actually shown to be involved, has an anti-inflammatory and immunosuppressive action. So, according to a cross-sectional survey of 113 patients experiencing pelvic and perineal pain, dyspareunia, or endometriosis, 23% already used cannabis. So, if you're taking into account the social factors here, a lot of these patients are self-medicating with cannabis. 96% of these patients found it to improve their pain, their cramping, their muscle spasms, anxiety, depression, libido, and irritability. So this is a huge improvement of pain and improvement in quality of life according to these patients. Another study used a compound PEA, which is classified as a cannabinoid, and it examined how it impacted the quality of life of patients with endometriosis. The study found that there's a significant positive effect on dyspareunia or the female sex life. Additionally, there was a statistically significant improvement in dysmenorrhea and chronic pelvic pain. Now I'm going to talk a little bit about acupuncture. I am by no means an acupuncture specialist, but from what the literature shows, it works by puncturing the body with needles at specific angles, which then activates neurotransmitters, causing a psychological and physiological change, and deactivating pain processing centers in the brain. So acupuncture for endometriosis, there's a few studies in the current literature that show that the effective rate of acupuncture for treating endometriosis was 95%. Again, quite effective. However, of note, these are all subjective studies because there's no real objective way to study how acupuncture could be modifying pain. In addition to better control pain, patients undergoing acupuncture also experience improved quality of life scores, which was the most common way that these studies were examining improvement of pain, increased pregnancy rates, and adverse effects and rate of endometriosis. So in summary, the endocannabinoid system and acupuncture both show promising ways that pain can be decreased for endometriosis patients. There are very limited side effects with long-term use as opposed to other medications. And acupuncture and cannabis are both shown to improve quality of life. Additionally, these are methods of managing pain that some of your patients might already be exploring and that you might not know about. So some discussion points from the literature review that I did. Most clinical use of cannabinoids is for antiemetic and palliative therapy. So some further exploration should be done to show a more evidence-based mechanism that cannabinoids can be used for pain management. A lot of these studies that I reference in my presentation are from patient surveys, and they're quite subjective. So more investigation needs to be done to come up with a stronger, more objective evidence. And patients are going to identify their pain, and they need to know what options are available to them. Endometriosis, while I think the OBGYN community is very aware of, I think a lot of other providers might not know how to recognize these pain symptoms that their patients might be experiencing. And so endometriosis can go quite underdiagnosed. Another major discussion point is the legal concerns and abuse potential of cannabis, which are definitely valid concerns and should be discussed with patients. And in addition to the research that I did do, I found that some of the articles discussed other alternative mechanisms for pain control, and this includes diet and exercise. So exercise as an analgesic, I think a lot of people talk about exercise as an analgesic, and it works primarily by targeting inflammatory pain. However, one study showed that evidence was not very strong, and only 2 studies showed a significant improvement in pain with exercise or no impact at all. Another study looked at diet on pain perception and showed that actually a high intake of a polyunsaturated fatty acid, a gluten-free, and a low nickel diet may decrease painful symptoms in endometriosis, which I thought was interesting, but it was only one independent study, so potentially not a very strong option. And these are my references. Any questions?